Pesticides are chemical compounds with toxicological properties designed to control pests. These are generally animals and plants deemed damaging to crops. Their use, mostly in agriculture, has become widespread since World War II. There are three main types of pesticides: herbicides, fungicides, and insecticides. The world's biggest consumers are the US, Japan, France, Brazil, and China. Pesticides are often criticized for their harmful effects. This is because their toxicity is not limited to the species they're designed to eliminate. They impact on biodiversity by killing insect pollinators, damaging soil quality, and polluting groundwater. Questions remain over how their toxic nature affects humans, in particular the farmers who handle them. Significant levels of pesticides are also found in consumer products. This can pose various health risks like allergies, asthma, reduced fertility, or cancer. Organic farming aims to avoid the use of pesticides in favor of other, less harmful alternatives.
Good morning, everyone. Thanks for coming. I know that a lot of the city is in mourning today.
Yes, I'm shocked.
So I was saying, I wasn't going to say a word about what happened, but I think it's worth at least mentioning and not pretending that it didn't. But it's wonderful to see everybody here this morning. And my name is Charles Plackett. I'm the Executive Director of the New York City Food Policy Center at Hunter College and a professor here. I also want to thank Christina Zarkadoulis. Dr. Zarkadoulis was kind enough to reach out to Fred Perez, Dr. Fred Perez, who is from Brazil, and to create this event. And we're going to record this event so that for those that weren't able to make it because they felt too sick this morning, at least we'll have a recording and we'll be able to have it on our website. And it really, pesticides are something that is certainly of concern and tremendous concern. And I remember when I was getting my PhD, I had a statistician and we were talking about this particular issue about workers. And this was in Florida where there were a lot of migrant workers. And it was something that I guess wasn't really discussed and wasn't really talked about the way I thought. And I started looking at the research and saying like, oh, look, there's not a lot of research on the impact of pesticide workers and what they do. And the rationale was because they're migrant workers and it's hard to track and get research on and get good data. So I think this is something that's really important because I felt like if we knew what was going on with these, with the impact that pesticides had on migrant workers, that we would actually know what the impact would be on us as eating the foods that have these pesticides on them. So I'm really happy and excited that Dr. Perez is here from Brazil, and I'd like to welcome him. And sorry the attendance isn't normally what it is, but I think you understand. You just had some similar issues in Brazil, so I think you can commiserate to some degree. And for those that are Trump supporters, well, congratulations. Yeah, right. Welcome.
Good morning, everyone. It's a pleasure to be here, and thank you so very much, Charles and Chris, for the invitation. So, my name is Fred Perez. I'm a researcher at the Brazilian Ministry of Health at the National School of Public Health in Brazil. And for the past 20 years, I've been working in rural communities, trying to understand the impacts of pesticides use in human and environmental health. So basically, I have a background in public health and environmental health. I'm a biologist, but with a background in environmental and occupational health. And I would like to bring some information about the pesticides used, and a few have data from Brazil, and also show you a few case studies that we've been working and conducting in our country, so you can have a sense. But I will try to do a brief presentation so you can have time to talk and discuss a little bit. And as Charles said, today is a weird day to be here and working, but we have been there and we've just experienced the same situation, at least the same feeling that you guys are feeling a couple of months ago when our president was impeached due to a fabricated crime, due to a non-existent crime. So you have all my blessing, you have all my sympathy, and Brazil is strong, the United States are strong, and we will survive.
That's true.
So, pesticides and health. Brazil, as you may know, is the biggest pesticides consumer in the world. Our estimate is about $8 billion in terms of the market a year. Herbicides represent 60% of all pesticides consumed in Brazil. And among pesticides, just one type of pesticide, the glyphosate, represents half of all pesticides consumed in the country. And glyphosate, I'm not sure if you know, they are used in soybean production. Brazil is one of the largest soybean producer in the world. And half of all the pesticides in the biggest pesticide consumer market in the world is just one pesticide. It's glyphosate. We still have many issues regarding health data and how our health systems can account pesticides' health effects in our country. We have very non-accurate data in our health system that they usually report around 14,000 cases of poisonings a year, but we know that's much bigger than that. The WHO used it to do an account or an estimate that for each case that we have notified in developing countries, there are at least 50 other non-notified cases. We expect that to be higher than that, but the Brazilian Ministry of Health used this correction since the 2000s. So we estimate that we have in our country something around 70,000 to 100,000 cases of poisoning.
The mic keeps fading in and out. Move the mic more towards your face.
Now,
yeah.
yes,
Yes.
okay, sorry about that. And all this data that I'm bringing to your attention here related to the poisoning cases, these refer to a direct identification of cases when you have the exposure and then you have the case immediately notified. But there are many other chronic issues that are caused by chronic exposure by pesticides, such as cancer, such as allergies, and such as neurological problems. They're not accounted, pesticides are not accounted as the main cause of that. Besides that, we have... Now it's better?
Yeah.
Yeah.
Yes.
Oh, sorry about that. And besides that, we have a cultural and social situation in our country that we estimate that 40% of our population do not know how to read and write in Brazil. We have a very serious problems in terms of the quality of rural schools. Rural schools usually go to the primary level, and they really lack of quality. They're not accredited, a few of them. They mixed classes working there, it's very complicated thing. And this was something as a result from our old laws that required people to vote, they need to sign their names. So many schools in rural part of the Brazil only teach people how to write their names so they can be able to vote. We're still bad voters, I can tell you. But now the school has a very much broader and interesting educational program. And we can identify at least 3 levels of health literacy associated to this problem. Yeah, this problem, I mean how people perceive or not the risks related to pesticides exposure. One of the problems is that many people who eat food or who work in the fields or even a neighbor from areas that are productive areas, they do not know the harmful effects of pesticides. And this is something that we still have a lot of uncertainties in terms of scientific knowledge and also in terms of scientific literacy in the people. They really don't know the harmful effects of these chemicals. We have a very low risk perception among those who use pesticides in the work, rural workers in our country. Many people do not believe that pesticides can affect their health, even if they're having some information about it. If they have health education programs, they have received many information, they still don't believe that pesticides can harm their health. And we have a third level of health literacy or illiteracy, that even people that know that pesticides can affect their health and the environment, they still use and they deny that it's possible to have, and I'm going to show you a few examples about it, about the situation of risk denial that's very important among, especially among male adult rural workers. And to try to simplify a very complex object of study is very, I don't want to do that, but if I could put it to a chart, it would be like that. We've done a lot of advance in terms of understanding the direct and the indirect impacts of pesticides in human health. We have developed exposure analysis, exposure assessment. We have developed epidemiological protocols, but we don't have, we didn't develop very well what is in this green box over there, that the understanding of the determinants of these impacts reduction and amplification and how people effectively get sick from pesticides. And this has to do with socioeconomic determinants, the socioeconomic determinants of health. They're very poor addressed in our country. It has to do with understanding people's and workers' risk perception. It has to do with health communication, risk communication, and also legislation enforcement in the country. So this green box here is the area that I've been working mostly in the past 20 years, and I'm going to show you a little bit about this work that has been conducted in many sites in our country, from the north part of the country, that's where the Amazon region sits, from the south part of the country, the borders with Argentina and Uruguay, where the agricultural production is very, very hard, to the center of the country, where the soybean production is, where the most productive soybean areas in the world sit. And just another information, since we have the change of the government in Brazil, the biggest soybean producer in the world, not in Brazil, in the world, became the Minister of Agriculture of our country. So this is something that's very important to be aware of, and I'll show you some. Well, during these years, we've been conducting some risk analysis and risk management studies. Since my school belongs to the Brazilian Ministry of Health, we had to do research associated with health management and risk management initiatives. So we developed a basic study design that's presented in this picture over there, and we used two models, two American models, in fact, one from the EPA, the Environmental Protective Agency, for the risk assessment, and the ATSDR, the Agency for Toxic Substance Regulation, for risk management. And we did a mixed model of these, combined risk assessment and risk management in which we included risk perception and risk communication as a main part of the program that goes all through the initiative from the beginning until the end. We analyze and we use data from risk perception to produce better risk communication and to help facing the problem, along with legal aspects that we can identify during these initiatives, political aspects, the social determinants, the identification of available technologies to overcome with the problems, and of course addressing the economic impact of that. The basic study design in terms of the steps that we do. On the risk assessment part, we've done identification of danger, hazard identification. It's not well translated, it's hazard identification. Dose response analysis, all the toxicology tests. We've been working with several laboratories, and our school has the National Toxicology Lab is in our school, so we collaborate with them to do this kind of analysis. Exposure assessment, risk perception studies, and for the past years, in the collaboration with Dr. Zacadulas, I've been incorporating health literacy into the risk perception framework that we use for this one. And the risk characterization is the part that you bring all this information together in terms of understanding what kind of options do you have to face the problem. In terms of risk management, we usually do a matrix. This is one of the matrices that was developed by the environmental management area of WHO, the deep sea matrix that goes to identify the driving forces, the pressure, the state of the environment, the effects on the health, and to understand which actions are available to face the problem. We also do health surveillance. We work together with the state and the municipality departments of health to do a better information system, and also to articulate with primary health care and other levels of the healthcare and the health system. Environmental remediation, every time we identify a situation that requires this measure, we have to talk with people at the Ministry of Environment and other institutions that help us to do the environmental remediation at these sites. And of course, we do a lot of risk communication initiatives, and I'm going to show you a little bit of that. Basically, what makes the difference in this model is that we try to engage community from the beginning. We try to engage. So these are basically community-based parts, but are research associated with risk management initiatives. And we consider risk communication and risk perception as non-dissociable. We think that in these white letters, you're going to find all the technical aspects of risk communication that we consider, the contents, the message that we develop for better communication, the medias we're going to use, the instruments we're going to develop, educational material, informative material, to put the information with a dialogical model of information that at the same moment, technicians and non-technicians, the community, they are speakers and listeners in this process. So it's a dialogical process that not only focus on these technical aspects of the communication, but you have to consider people's culture, historic aspects, the social cultural determinants, and of course the life course of each group, both experts and non-experts people. So we understand that risk communication and risk perception are non-dissociable. That's it. Now let's talk about the case studies that I have selected for you. Lucas do Rio Verde. Lucas do Rio Verde is in the middle of the country, as you can see, in Mato Grosso state. It's the biggest soybean producer and the most productive soybean production area in the world. That's from this area that this guy has his farms, and he belongs first. At the time Chris went there, he was the state governor, and now he's the Minister of Agriculture, Laimage, the one I mentioned. And this region is most of the crops that do that are soybean, maize, and cotton. And these three rural commodities, soybean, cotton, and maize, they account for 42% of all Brazilian exports. So from everything that we export, 42% is cotton, corn, and cotton, soybean, and maize. Usually big plantation, big farms like this one, farms that go up to the people's house, that goes to the cities. Sometimes they need pesticides needed to be sprayed through airplanes. It's not individual stuff, or they use airplanes, or they use these huge tractors with high pressure pulverizers and sprayers that do the pesticide spraying in the country. And there are no limits between these crops, these farms, and the cities and the houses of people. This, for instance, is a school that we've been working with the children at this school. And the school is completely surrounded by farms, by crops of soybean. In this city in particular, I want to mention one case that they were doing a pesticide spraying by plane, and they were about to pass through the house of an important politician in this city. So the pilot said, oh, I can't do that because it can drip pesticides and I can kill the trees of these, I think it was the vice mayor or the deputy mayor of the city, something like that. So this guy made a detour to avoid his farm, but he made a detour through the urban area of the city. And there was a very important pesticide drift in the area that kills mostly of the vegetation in the urban area of the city. And this, the legal system identified was a really problem. A lot of local community associations went through the legal system and they sued the governor and the mayor for that. And that's why my institution was called to do this kind of assessment, because they need reliable data to show that the pesticides used there in this city was causing any harm to the people. And we identified several problems, from some chronic intoxication issues, a lot of cases of cancer identified in this situation. Pesticides used in agriculture were present in breastfed milk, so many of the mothers had residues of pesticides, and this was huge in the country because the media reported that it was a very national concern about it. And children from the age of 10 or 12 start working in this area, since the school ends when they are about in the 5th grade in Brazil, when they are about 10, 11 years old. So that's when they begin to work with. Another region that I'm going to talk a little bit about too is in my state, Rio de Janeiro state, where Fiocruz sits and where I live. This area is up in the mountains and is the biggest vegetable producer area in the country. So these are a completely different situation. These are small farms, family agriculture, the entire family is involved with the cropping process. And when we were asked to come to this region because they were noticing a few health problems and including a few deaths were noticed that region, and they were thinking about pesticides as a probable cause. So they invited us to come, and when we arrived, we identified a situation like that. This is a rural worker doing the first hydration of pesticides, the formulation of pesticides. So they use the pesticides in powder, and they add a little bit of water to do this thick mixture, and then this will be completed with 50 liters of water, a lot of water, and then will be sprayed in the crops. And they do not use any protective equipment to do that. And this is a very common in this region. In fact, this guy here, when I took the camera and asked him the permission to take the picture, he picked up this small stick because he was about to do it with his bare hands. They usually do that, this kind of mixture with the bare hand. This is another situation that many of these areas, they do not have pavimentation in their roads, in their main streets. So these are basic sand roads and sand streets, and children need to play with their bicycles, with their tricycles, and they usually do that in the same area that they store pesticides in the farms. And even if people think that they are protecting themselves using equipment, and in this case, I'm telling you, it's completely inadequate equipment that this guy is using. Sometimes women and children help their parents, auxiliate their parents in the spraying process, as you can see in this second picture over there. And in this case, both women and children do not use any protective equipment. So we need to understand what was happening there in this area and what led the people not to protect themselves. So we did a very large risk perception study with 300 adults, women and men, and we identified that in the case of women, women didn't see the risks they're exposed to because they thought that they were just helping their husbands, their fathers. They are not working. They didn't see themselves as workers, but they did that 3 times a week or 5 times a week in the middle of the cropping season, and they didn't consider themselves. And sometimes the husband or the father was using the correct protective equipment, but not the woman. So we saw the same situation that we see here with this kid, the exposure, because here you can see the pesticides is in these containers here, and there is a pump that pumps the pesticide, spray the pesticides through these very long rubber hose that we have here, and it's high pressure. And there is a need of a person to go along with the person who is spraying that to go and to pull this rubber hose, otherwise it will be stuck in the middle of the crop. So usually this work is done by women and by children, and they're not using any protective equipment. And another thing is that women are responsible 100% for the cleaning of the clothes and the cleaning of the equipment used in the pesticides. And they see that as a house job. They see that as something that's not dangerous for them. So when we did all the toxicological and clinical tests with the women, we saw much more women intoxicated and with exposure markers affected than men. So it was a really important problem of risk invisibility, the invisibility of risk. The people don't get it. In terms of the men, is the opposite. Men, rural workers, especially men from age between 35 and 50 years old, adult males, they know the risk they're facing. Most of them know the risk they're facing, but they choose to use pesticides in the same way. In some cases, in fact, in many cases we've seen that these workers try to face the risks. They try to defeat the risks as a virality measure. So they say, oh, I will not use a protective equipment because I'm stronger than this chemical. So I will prove to myself that I'm a good worker. And they usually say that a good worker is the one who doesn't fear anything. It's very common. You can hear a lot of this in the rural areas. With older workers, what we're seeing that there is a reinforcement of these defensive strategies, because these are defensive strategies. These are ways that these workers developed to continually working in this area, especially areas like this one in Rio de Janeiro, where the profit is very good. So these are not poor rural workers, these are wealthy rural workers. And the older workers try to reinforce this kind of defensive strategy among the newest one, the youngest generation. The sentence that recording the interviews, it was with done in-depth interviews, semi-structured interviews with these workers. 328 people took part in this study, this particular study, and the sentence the quote that we recorded most was that, I've been working for 30 years and I feel good. So pesticides don't harm anybody. And perception in these workers only related to those who have experienced intoxication cases. And when I mean intoxication, I mean the acute poisoning and the classic symptom of an acute poisoning. Let's talk about another region. Let's talk about Partido Alferes, which is also in the state of Rio de Janeiro. It's also my state. And it's the largest tomato producer in the country. And as you may know, tomato is one of the food that requires most pesticides because of it has a thin skin, so need to use a lot of pesticides to grow tomatoes. In this area in particular, as you can see, in all the state of Rio de Janeiro, the average of pesticides consumption is about 3.2 kilos per worker a year. So they calculate the amount of pesticides used in certain region. They divide that by the number of the rural workers that work in this particular area during 1 year. So they have this number. 3.2 is the number of Rio de Janeiro state. In our region, the southeast region of Brazil, it's 12 kilos because São Paulo state, they have an average of 28 kilos per worker a year. But this area, this particular city, they consume about 56.5 kilos. So it's the double that we have in the highest consumer market in the country. We did a very tiny, a very shy risk perception study with adults, and I say shy because they didn't allow us to do a deeper study with them. They refused to take part in the study. It was really hard to work with adults in this particular city. And we identified that 90% of them didn't use protective equipment. 30% of pesticides were the highest toxicological class, which means the most toxic pesticides they were used in this area, 30%. 40% of the inhabitants were illiterate, don't know how to read and write. And in this region, saw a lot of children working in the crops. Children starting from the age of 7 and 6 years old. So we decided to partner with the Department of Education of the city to do a risk perception study with the kids. And the first challenge was how to do risk perception studies with kids. So we went to a friend of ours in Mexico who had done this kind of study with mining, the children of miners of some regions in Mexico, and they use drones. So we talked with them, they gave us the protocol of how to make drone, and we did a study with 158 students from 88 from rural schools and 70 from urban schools in this area. So the students had to do drawing, and we asked them to draw their parents working. We didn't say any detail about us, about pesticides, nothing. Just draw your parents working. Then it usually take like 10, 15 minutes. After that, we asked them to explain what they've just drawn. And by the end of their explanation, we asked them to complete the sentence. Pesticides are, and they have all the answers. In terms of the results of these drawings, 60% of all drawings refer to pesticides. They had at least one representation of pesticides. We didn't mention pesticides.
50%?
60.
60.
60. Yeah. In terms of numbers, many drawings represented residences closed or inside the crops. One, preparing pesticides, using pesticides without protective equipment, and children working. A lot of children represent themselves working along with their parents, like this drawing, as you can see. And the explanation for that is, this is my mother and father, and I'm helping them to protect our tomatoes. Here, a mom and dad going to work. How beautiful our tomatoes are. Oh, we have to take care of them. This is what's telling in the charts. This is another one. The explanation say, here is my father working with the tomatoes at the tomato crop. And pesticides don't cause anything. He is protected. Here's another mention of the crops. The worker using a protective equipment. And they also represented a guy delivering the empty bottles of pesticides in the proper place they have to do that. And we just asked the children, represent your father working. That's it. Here, a mention about health. They had a crop, and they say, oh, if you don't use pesticides carefully, you're going to get sick. And then you have the representation of a hospital there with a kid coughing at the hospital. So, based on this quick information that I brought here to discuss what can we do and what we've been doing for the past years about pesticides, and then we can start our conversation here, we can start talking about it. I'm going to show you just a few examples of how we could address the situation in terms of risk communication and risk management. For instance, for these three different situations. For women, we identified a need for to show the women the risk they're involved with. First, to make themselves perceive as a worker and not as a helper, or that only the husbands or the fathers were at risk. So the risk invisibly, in this case, was very important to bring risks real to the woman. In terms of the man, the situation was much more complex because you have to deal with this risk denial and to these defensive strategies. And you couldn't do a proper risk communication initiative for men except in two situations, well, the same situation, but in two different sites in the country. One in the north part of the country, Greece, was there in Arapiraca, and the other in Rio de Janeiro state. In these two cases, it's very peculiar how we did that, because in these two situations, men come during the project when we were doing the clinic, the medical consultation, when they see the physicians and they do the blood tests to analyze pesticides exposure. When the men come to have the results and talk to the physician, they ask about sexual malfunction and if it was related, if it could be possible related to pesticides. And in those cases, of course, the physician said, yes, it can, and we use it as a hook to get them into a risk communication initiative. And it was very good, and it was the only two times that we could work with men, rural workers, adults. In terms of children, we try to show them that it is possible to work in a different way that their parents do. That there are options for them, even if they consider they want to be a rural worker, and we didn't want to interfere in that because it's very peculiar, it's very common in the way that the rural family is based, that the work example can be transmitted through generations. It's very important. So we didn't want to interfere that, but we want to show them that there were options for them. And so I'm going to show you some results and some products of that. In terms of women, it's very tricky to do risk communication initiatives to women, rural workers, because they are working all the time. When they wake up, they go to the kitchen to prepare breakfast, they take care of the children, they go to the crop, they go back to work at the house to prepare lunch, and they serve lunch to their husband, and they go again back to the crop, and then come back. It only stops around 7 in the afternoon when they are completely exhausted. And the only thing that they do, besides working and take care of kids and the house, is to watch soap operas. As you may know, Brazil is very famous, and soap opera is huge in Brazil. So what we did, we couldn't do a soap opera, or at least could put this topic into a soap opera in the country. So what we did, we developed a photographic soap opera, which is also another thing that's very common, or it used to be very common in our country. It's called fotonovela. I'm not sure if you have heard about it. Fotonovela is a photographic soap opera that you have mainly the pictures representing the situation, and usually have very small objective sentence, but the picture itself represents what they want to do. And it's very Latin. It's very common in Latin America. Usually it comes with a romantic story. There's also a very passion. It's very culturally adjusted for Latin America. And we've done that. So we took all the results of the risk perception study, turned it into a fotonovela, a photographic soap opera. We used the lines, the quotes that were being recorded by this woman to do the texts here, so they could recognize themselves. And we did evaluation in 7 states in the country, 25 cities all over the country in 7 states. And even if the woman don't know how to read and write, she could understand the most important message from the material. And this material is still being used in other different projects in the country. So it was a very interesting. With children, tricky because we need to get their attention. So one of the things that we've been doing there is to bring children into risk assessment. So this is an example that we've done in Lucas do Rio Verde, that city in the soybean producer region. We took children from the schools, and that particular school that was surrounded by soybean crops to help us. And so here we are setting up a collector for rainwater. So the children were responsible for collecting the rainwater to seal the collector properly, and then they will call the university, they'll go there and pick up the collector with the rainwater sample so it can be analyzed in the lab. And every time that we had an analysis to do of this water, we invited 2 or 3 kids to come and to see how it's done. So they participated in the risk assessment initiatives. Here, they were very proud of this one, and they invited me, "Oh, Professor, could you come and see our little garden? We have an organic garden here in our school. We crop our own vegetables, and we don't use any pesticides." I said, "Oh, that's interesting, show me." And here, they showed me. And then I looked at, as you can see, all the area is surrounded by soybean crops. Pesticides, especially during the season, are sprayed at least twice a week in this area. So I said, okay, it's an organic crop, isn't it? Yeah. Could you find me, that's hard, I don't know the name of the insect. It's not a beet, it's...
Beetle?
It's not a beetle.
The ladybug?
Ladybug.
Ah.
Thank you very much. Could you find me a ladybug? And they couldn't find anyone. Okay, could you find me a worm? They couldn't find anyone. Okay, an ant. Of course, there will be an ant here. You don't use pesticides here, so probably you find it. They couldn't find it. And then they started thinking, oh, maybe it's because of the crops, blah, 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 blah. And this little guy over there said, oh, it's his father's fault. And then they tried to, and they finally understand that they were at a risk situation. And with the school, we could work alternatives for it. Of course, the best alternative was to remove the school from this area, which was really impossible. But to restrain pesticide spraying by plane, we could do that. So they don't have it anymore in this area. Here, another picture of students collecting water for a basin. And this is important to show because we have bothered many people in this area doing this kind of study, of course. And one of the things that we've been doing is to report all the results publicly and to the legal system, because we were invited there due to a legal suit that was taking place. What happened is that this professor here, Chris, knew him, Ignati, received a death threat, and he couldn't work here anymore. And this researcher here, who was the girl was doing the breastfeed milk study, she also received a death threat, and she had to move away from the state. Ignati still works in the state. He is an old professor from the Federal University and a very known professor in this area, but he couldn't work in this city anymore. And the girl needs to move away from the state. Here, another example. This is in the tomato producer area in Partido Alferes, Rio de Janeiro. We decided to do science fair. So every year we did the combination. We did the combination activity with all the primary schools, both in the rural areas and the urban areas. We partner with the local Department of Agriculture, and they built organic gardens in each school of the rural area. So the children could learn how to crop without using pesticides, and they consume this food during their time in the school. Here is an example of the science fair where a drama teacher put up a theatrical sketch, and it inspired me to do something more, to write a comic book, to try to show the children in a very ludic, in a very interesting way that there are options of doing pesticides use. There are options of doing crops without use of pesticides. So this was also, we used the quotes from the risk perception studies and built this risk communication material here. It's a comic book. I brought us a few samples of the comic book in the fotonovela. Unfortunately, it's in Portuguese, but it's available for you. It's right here. And with that, I'm concluding saying that the traditional model of understanding pesticides exposure and pesticides health effects that usually combine human exposure analysis with the contamination assessment or environmental assessment or even work processes analysis or assessment, they're incomplete when they do not consider, in the scope of the analysis, the risk communication aspect and the risk perception aspect. And these are the only pieces of this puzzle that can make education work. And the way we do that is to engage people into the solution of the problem. So we can bridge evaluation to intervention through not only the local action, community engagement, but also pointing risk perception as a major factor, as a major contributor to the solution. To understand risk perception as one of the key features of this. Here are my contacts, and I thank you so very much. And I'm ready here for questions. And thank you very much.
So we'll take a series of questions. I have a couple first, and then we can. So I guess one of the first questions I have is, what's the community reaction, especially to the to the heads of household, when you do go into the community to do risk communications to family members?
Okay. So it depends on the situation. For instance, if you go through the legal system as you're required to be there to do an analysis, you don't have a good reception. So it's really hard, and you have to build what partnerships we can do to overcome the situation. For instance, in Lucas do Rio Verde, we couldn't do directly with the health system. We had to go through the educational system, so through schools, because the schools had the interest. The Department of Health was not interested. The Department of Agriculture was not interested, because they are both connected to the economic activity, which was the soybean production. But the education department was. The people there were a little more independent, so we partnered with them, we could work there. The other thing is that showing the people that the engagement in the solution is relevant. There is no communication if there is no interest in hearing us. So what we try to do is try to identify which aspects they care about, and we can start from there.
I just wanted to follow one follow-up. So it's just in terms of your position, is it the Ministry of Health versus the Ministry of Agriculture?
Mm-hmm.
what is there? Is a lot of tension because you're doing work that's directly conflicts or appears to directly conflict with the Ministry of Agriculture, especially in his soybean, you're right in his space. So,
Absolutely.
yeah.
Yes, there's a lot of conflicts, for sure. And even inside the Ministry of Health, because we're the National School of Public Health, and we are part of an institution called the Oswaldo Cruz Foundation, which is the equivalent of your NIH. So we have a kind of independence. We are connected administratively to the Ministry of Health, but we have an independence. We have our own laws, we have our own rules, and we are all public servants. The government can fire us if we do a report that's bad for them. Even inside the Ministry of Health, sometimes there are diversions. For instance, in the case of the breastfeed milk situation, the minister himself went to television, to national television, to say that women should keep breastfeeding their feed, despite of all the controversy of our results. So our boss, the Minister of Health, he disaccredited our study. Sometimes it happens. With other ministers, it's crazy. It's crazy. In terms of agriculture is always questioning legally our studies, our actions. So we have to prove to the academics and we have to prove also to them. At some point, they are just asking for more information. They ask us to prove and blah, 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 and we present it. It's much more bureaucracy and a lot of work, of course. But in this case, specifically in the Ministry of Health, it was very complicated because the minister himself went to television and said, mothers, you need to continue breastfeeding. It's more important. And the results of this study is not conclusive. It was conclusive, I can tell you.
Well, just as an aside, not to paint it that it's so much better here, we have historically had cases where the head of the CDC will come out and say, there is no risk to the general population in Texas for Ebola. You know, when there is no scientific evidence that that is true, that we are indeed at risk. And there are things that are propelled by pharma in this country that are often or outweigh what our national representatives say. But aside from that, I wanted to, historically in this country, public health has been very leery of doing advocacy. It's really, you know, your public health is your education. And, you know, it's even now hard, if not impossible, to get an NIH-funded health education, health promotion program if you're doing outright advocacy and or if you're educating the public around a risk that they do not have the means to do something about. Because that's, ethically you have to say, gee, can I go in and tell people about this brownfield site that they're living on, the toxic exposures there, like Love Canal, if they can't sell their houses and get out? Oh, then the government had to come along and, you know, buy all those houses from the residents, which is very rare that that happens. So how do you decide what outreach and collaboration you do with the community if the community doesn't have the means to lower their risk, ameliorate their risk in any significant way?
Well, these are what establish the boundaries of how long or how far can we reach or can we go. For instance, if we identify, we've been identifying situations where the health problem, especially we've been done, these are not in rural areas, these are related with public health campaign, the use of pesticides in public health campaigns. So many organochlorinated pesticides like DDT and BHC used 20 years ago and they're not being used anymore in our country. They affected the health of the people. But you don't have anything to do except to follow up there closely for the treatment. And sometimes it's just that. It's just bridging with the local health department to improve healthcare for these people. Sometimes we just do that. That's our limit. The
But
other
that's
thing,
doable.
that's doable, yes. So we decided that we don't have how to do a risk communication campaign, we don't have to do an awareness campaign, but we can do that. In other times, what we can do is just to tell people that there are options. And then literally have to let with them to decide which options they have, just to show the implications of their decisions and to show their options. And, of course, since we are the government, try to partner with the local authority, with the local law, to improve these options for them, to make them.
So what is an
viable.
option for a Brazilian woman who's helping her husband in the field? What's an option?
First of all, and many options like this one, we discussed in this material. First, if they keep doing that, they need to know they're workers and they need to protect themselves as any worker would do. Second, they can go to the public health system and have their health evaluated. If they go like monthly or every 3 months to the health clinic, and the local doctor, which is also trained by us, will identify if she's experienced already any symptoms of exposure, and then do early treatment to them. So this is something that we can do, and these are options that we offer usually in these materials.
Thank you.
Had a kind of a follow-up or just to tag on. I was interested in how much does it cost to have the personal protective gear, and how, who is
Very
responsible for providing that to the farmers?
Very cheap. It's, let's say, it's 50 reais. It will cost something like $12 to have an equipment like that. And we are talking about wealthy workers here in this situation. But even among the poorest workers that we have in this situation, the owners of the farms can provide it. Usually, due to the Brazilian legislation, the owners of the farm have to provide the protective equipment to this person.
So there is a policy in place,
Yes.
and even for those women and children? who are
Absolutely. Including for women and children especially, is much more restrictive. The question, the thing here, the issue here, is not the absence of legislation, it's the enforcement. We don't have enough officers to enforce this law, to do the surveillance in the camp.
The other question that I had was about, your impact on the students, right? So you're targeting the students, and are you following up with their parents at home, or are you using them to mobilize change with their family, or what have you found?
We've done that in 2 situations. One was this one that I mentioned in the tomato producer area, the tomato production area. We did a follow-up because we couldn't access the parents. We couldn't access the male parents. So we did it through the students. And what we've seen is that their parents becoming more aware of risk, or at least adopted more protective measures during the work processes. So yes, we could do that. We usually do that through schools. We distribute this material along with like a guideline for the teachers and for the school administrators to work this material among their community of children, students, and parents. And then through them, we stimulated in the PTA meetings to do this kind of focus groups or any other activity that could give us a feedback about it.
I wanted to ask, what actions can the workers take to discourage the wide use of pesticides on farms? Would it be through strikes or maybe legislation?
Well, it's hard. First of all these situations that I presented here, we are talking about independent workers, because these are the landowners. Even the pesticides, the soybean production, large crops, people who work there usually are their owners, the parents, because it's all a very high level of mechanization. So usually take 2-3 people to control the pests in a huge farm. They have tractors, they have planes. So these are not a model like we have, for instance, in fruit production in our country, where they hire many workers. And in this case, what they can do strike, of course, but there are at least 50 for each worker who is employed, there are at least 50 or more unemployed waiting for the spot. So it's hard. If they do anything else, they lose it. And in the actual economic situation of the country, it's complicated.
Hi, you mentioned corn, soybean, and 3 crops,
Cotton.
commodities, cotton. Most of them are GMOs.
Mm-hmm. Yes.
So you've been working a long time. Would you comment what happened with the GMO crops? More pesticides?
Perfect. Yes, that's exactly what happened. Because the first impression, at least the speech that the companies used to do to sell GMO crop in our country was the possible decrease in pesticides use. But what we observed that when we started doing that, we are the number 4 consumer of pesticides in the world. After especially in these 3 crops, GMOs, we become the number 1 in the world. The amount of pesticides used in our country has increased significantly.
And that's globally what's happening. There's a new study.
190% in 10 years. 190% in 10 years. It was already a high amount of pesticides, but now it's out of chart.
No more eating.
Well, I mean, you talk about deception in our government. Monsanto convinced everyone 15 years ago that this would reduce, GMO seeds would reduce the use of pesticides, and the newest study globally come out to say that there's no scientific evidence that has reduced the use of allowed to reduce the
Now you
pesticides.
can use Monsanto spray.
Yeah, so you talk about who's in bed with who. It's not just in countries like Brazil.
But here's the problem. Yes, you use the Monsanto spray, the glyphosate, which is account for 50% of all pesticides that we use. But we need another herbicide to make the crop, to do the harvest. It needs to dry the soybean grains and to do the harvest. And you can't use the glyphosate because the soybean is resistant, the plant is resistant. So we have to use another much more toxic herbicide to do the harvest. So it's tricky and became out of charts.
Which they also sell.
And in terms of the food that we are getting, this is the only good part of the story. The Brazilian population, at least good for us, and not so good for you. Because the Brazilian population is not getting there. Because all this cotton is coming to the US and to the European Union.
Nice.
The soybean comes to feed pigs here and feed pigs in China.
So you don't want to eat ham.
And the maize comes to do oil, to do the combustible, the corn oil here in the United States.
So I know we're running a little
Yeah, we're
late, so maybe
I'm
just
sorry.
one more question, and then we can, Fred will, well, she has the, she's here, but Fred will stay certainly, and, so that.
Thank you so much for your fascinating presentation. And I was curious about the role role or lack thereof, that you saw religion playing in your studies or in risk perception, if there was any association between people's religious affiliation or religious participation and their risk perception.
We never addressed this determinant in our studies. The other thing is that when we do health communication and risk communication initiatives, in many cases, in rural areas, many cases, we need to partner with the churches, the local churches, to to reach the people, to make the people believe in us. And so this is one of the trickiest parts of our study, because we have to establish from the moment zero the boundaries that we are going to establish. For instance, when I was doing the photonovela, I was planning to do a video, since 40% of the women are illiterate. It makes sense to make a video. But in these rural areas, the video, the DVD, the DVR equipment are just in the churches or in the politicians' houses. So we thought and got concerned about the religious or political use of the material and decided to go with the printed material. So it's true.
Well, I just want to say thank you so much.
Yeah, thank you.
And in my introduction, which I sort of went off script, I just wanted to say that you're just an amazing person that I've gotten to know over the last few years. And it's been, the work that you do is fascinating and interesting, and you care so much about the things that you're involved with. It's always impressive and amazing. So, and the amount of work, the times you come here to educate the hunter community has been fantastic. So thank you so much. Thanks for coming.
Fred.